Good afternoon, everyone, and thank you for joining us again today. Today, we're here to provide an update on how we're dealing with the current outbreak of COVID-19 in Yellowknife, Ndilǫ, and Behchokŭ, and the pandemic across the N.W.T. as a whole. We continue to look at a broad range of options to support businesses and families while keeping our residents safe. Building on the announcement of the self-serve proof of vaccination credentials earlier this week, on October 22nd, the Chief Public Health Officer will implement a voluntary proof of vaccination option through a public health order for non-essential businesses in the Northwest Territories. What does this mean? Non-essential businesses will be given the option to either keep their current restricted capacity limits or be permitted to have a higher capacity if they admit only vaccinated residents into their establishments. Vaccine status can be checked using either the new proof of vaccination released on Tuesday or their existing paper proof of vaccination. Dr. Kandola will speak more about the details on that momentarily. We'll continue to work closely with businesses and provide support and guidance where possible. While this means keeping tighter restrictions for those who are not fully vaccinated, it also means we can begin to emerge from this outbreak. The current public health orders affecting Yellowknife, Ndilŭ, and Behchokŭ will remain in place until October 22nd. However, it's important to note that the implementation of this program could be delayed if numbers don't trend downwards like we anticipate. In Emerging Wisely 2021, we outlined that we would use whatever targeted measures we could to address an increase in cases in the N.W.T. This is just another tool that will help us ensure that we're able to manage the outbreak while allowing residents who are fully vaccinated to get back to doing the things that they love. While this is positive news, I want to remind all residents that we aren't out of the woods yet. How we spend the next 8 days will have an impact on whether numbers begin to trend downward or the outbreak and restrictions continue. This is why I'm telling all residents to stay home as much as possible. If you don't need to be out, don't go out. There are other ways to connect with friends and family, whether a telephone call or a video conference. What steps we take next week relies on you all doing the right thing today. We all need to continue to follow the orders and the recommendations in place and understand that everyone is still at risk. The Delta variant is impacting residents of all ages and socioeconomic backgrounds. This isn't a vulnerable population virus. It impacts everyone. If you're going to be going out in public, be responsible. Wear your mask, wash your hands. Do everything we've been doing for the last 18 months. And if you haven't yet, please book your appointment and get vaccinated. It's the best thing you can do to protect your loved ones and the residents of the N.W.T. This is a difficult time for us all. We had hoped that our early success in this pandemic meant things would get back to normal by now. This pandemic is unpredictable, and because of this, we need to take these steps. I know this is a challenging time for many of you. The pandemic has taken its toll on all of us, so please make sure you're taking care of yourself. If you need help, please reach out to the many services available to residents. If you know someone who needs help, check in on them. We need to take care of ourselves, our loved ones, and our communities. Lastly, let's not let this outbreak divide us. We need to work together to get this outbreak under control. There's no value in pointing fingers or laying blame for the situation onto any one group. On that, now I'd like to turn it over to Minister Green. Thank you again for joining us today, Minister Green.
Thank you, Premier, and good afternoon, everyone. Today, we are reflecting on a new direction that we are taking with respect to the pandemic management. So, of course, for the last 18 months, the N.W.T was one of the safest places to live in the country. Unfortunately, that all started to change in mid-August when an outbreak began in the Sahtu and spread far and wide. And we're still coping with the cases that started in that location and fortunately have now waned there. We have the highest rate of COVID cases in Canada. That's not a fact I'm proud of. In fact, it's frightening, and it's certainly not where I hoped we would be this autumn. The COVID-19 Delta variant has shown how quickly things can change and how unpredictable and deadly it can be. While the N.W.T health system has been stretched by recent outbreaks, healthcare staff are doing an incredible job on the ground, providing the essential services needed to keep N.W.T residents healthy and safe. Still, it's important that we all continue to do our part by practicing good hygiene, staying home if we're sick, following the public health orders, wearing a mask in public, and keeping our distance from one another outside the household. Most importantly, of course, is to get vaccinated. Vaccination is the most effective defense against COVID-19. Yes, people who have been vaccinated can still be infected. Despite that, the science is clear. Those who are fully vaccinated are less likely to get or spread COVID-19 and are much less likely to get sick and need medical attention if they do. As the Premier just announced, in conjunction with the current public health orders and to further protect residents, proof of vaccination will soon be required for entry into some local businesses. From the beginning, we've been clear. While we highly encourage all residents to do so, the decision to get vaccinated is a personal one, and it still is. If you don't want to get vaccinated, that is your choice, just as each business will have the choice to implement this program. The Vaccine Passport program will enable businesses to choose to increase their capacity by limiting access to those clients who are fully vaccinated. This measure will allow us to resume more of the activities we enjoyed before the pandemic began. As a territory, we continue to head in the right direction. We are now 79% fully vaccinated, yet we are still below the national average, and we need to pick up that 21% who have not yet chosen a vaccine. Vaccination is readily available for any resident who requests it simply by contacting your local healthcare center or public health unit. Earlier this week, the N.W.T launched a new self-serve online form that allows residents to instantly receive their proof of vaccination in a format that is consistent across Canada and meets federal travel requirements. As mentioned earlier, this new proof of vaccination or your previous printout will soon need to be presented at the door of some local businesses to be granted entry and can be used elsewhere in Canada for this purpose as well, including the federal requirement to be vaccinated in order to fly. Because this is new technology, we do expect there will be glitches. For example, our QR code may not be readable in every other province and territory, as most of their scanners were built to read their own codes and proof of vaccine documents. Jurisdictions are working together to address this. The N.W.T proof of vaccine credential has been tested and accepted by the Canadian Border Service Agency. In the meantime, the new proof of vaccine credential can be either printed or saved on your phone and is an acceptable verification along with government-issued ID. I would like to thank all the staff who worked so hard to get this service ready to use. More than 5,000 credentials have been downloaded since this service became available on Tuesday. And I've heard nothing but good things about that, which is extremely heartening. So thank you for your attention. I'll now turn things over to the N.W.T's Chief Public Health Officer, Dr. Kandola.
Go ahead, Dr. Kandola. I have to unmute you. 1 second.
Thank you, Ali. Good afternoon. Before I begin, I would like to acknowledge the anonymous residents that dropped off gift cards to an isolation center over the weekend. Staff distributed the donated cards to a happy group of guests. Thank you for your kind and thoughtful gesture. On a more somber note, it is with great sadness and a heavy heart that I must offer my condolences to the multiple families who have lost a loved one over the past week. The pandemic continues to negatively impact our lives. There are families, friends, communities suffering significant loss, not only of the person they once knew, but the knowledge and experience those individuals brought. I will keep every one of these families in my thoughts and prayers as we move forward. When we talk about severe health outcomes, this is one of the outcomes we are talking about, death. Being fully vaccinated increases the likelihood of avoiding severe illness and death from a COVID-19 infection, but does not prevent you from passing the infection on to others that are unable to be vaccinated or at a higher risk for severe outcomes. So please keep these families and yours in mind when you are making your choices to go about your daily lives. We are seeing an increase in severe outcomes, hospitalizations, and death from COVID-19. And I do remain committed to serving the public to the best of my abilities, making informed decisions using up-to-date scientific research and data analysis. I am also relying on the kindness and resilience of Northerners to lead us forward as we emerge from the worst outbreak in the Northwest Territories since the pandemic began. Incidents of COVID-19 in Behchokǫ, Dettah, and Ndilǫ and Yellowknife appear to have peaked and are trending downward. However, the number of active cases still pose a significant risk to our community members. The outbreak is not over. I have made the decision to extend the public health orders in these communities until 5 p.m. on Friday, October 22nd. This extension will likely confirm that the results of the past two days are a downward trend in active cases. It is better to follow data that confirms we are reaching the end of an outbreak than to open up too early, as we risk losing all the gains we have made thus far. Fewer active cases reduces the risk of taxing our health system capacity and means we can more quickly respond to issues that arise. Schools will remain closed in-person learning, and I continue to recommend that businesses accommodate working from home in these communities through to the end of this extension. These additional measures support the reduction in transmission for indoor gathering spaces so that there's less opportunity for the virus to regain momentum. On Tuesday this week, the N.W.T released an electronic proof of vaccination. This can be downloaded to your phone or printed off and carried with you. Either option, when combined with photo ID, will act as proof of vaccination. On Friday, October 22nd, I intend to introduce a new N.W.T-wide public health order. This order will outline how the proof of vaccination can be used by non-essential businesses and organizations as an additional measure that they can use to increase their capacity. The proof of vaccine option is a voluntary measure that can be applied through an application process under the new gathering order. Non-essential businesses and organizations that choose to use it can increase capacity limits by verifying the vaccination status of their clients. It would also only apply to those that are eligible to receive the vaccine. So those under the age of 12 would still be able to attend these activities or establishments without the need to provide proof of vaccination. Current accepted exemptions to vary from the public health order will expire on Friday, October 22nd, and a new streamlined application process will be introduced next week for businesses, organizations, or events. Additional details will be communicated shortly. So the new N.W.T-wide gathering order, planned to go into effect October 22nd, will be put in place for the following reasons. With the weather turning colder, more gatherings will begin to be held indoors with less space to distance from each other and closed windows limiting ventilation. By decreasing the number of individuals in a space, we are reducing the number of contacts. Gathering together with fully vaccinated individuals presents a lower risk than gathering with non-fully vaccinated individuals. National data excluding Quebec, collected from August 22nd through September 18, shows that unvaccinated people were 10 times more likely to be a new case of COVID, and that hospitalized cases among unvaccinated were 36 times higher than in fully vaccinated individuals. In the N.W.T, there are twice as many vaccinated residents over not fully vaccinated residents. And what we are seeing is that fewer cases in the fully vaccinated population, even though they outnumber the not fully vaccinated 2 to 1. 64% of our hospitalizations are in unvaccinated individuals, who make up a small percentage of the population. Vaccines continue to protect against severe outcomes of COVID-19 infection. They are not perfect, but they significantly reduce the risk. By allowing non-essential businesses and organizations to apply this additional measure or requesting proof of vaccination, we are reducing the risk of severe outcomes from an event or establishment, while maintaining the least amount of restrictions that are necessary to protect our communities. We are also allowing for the public to make informed decisions on what type of businesses or activities they would like to attend based on what measures are being exercised by non-essential businesses or organizations. And my team will continue to monitor the outbreak situation and make informed decisions on next steps. Additional information about non-essential businesses and organization exemptions, proof of vaccinations rollout, and the N.W.T-wide gathering orders will be communicated next week. Thank you for your attention.
Thank you, Dr. Kandola. All right, thank you everyone for your remarks. We will now move to the question period, and we are having to unmute folks manually on our end. So I would ask that all media members who are in attendance, who have RSVP'd to the event today, if you have the ability to please change your name to your the name that you used when you RSVP'd, as well as your media outlet, so we can properly unmute you when it comes to your turn to ask a question. I'm going to give you the order that we have for media questions. For now, we have Thomas Chabot from N.W.T. We have Ethan Butterfield from NNSL. Following that will be Emily Blake from Cabin Radio, then Luke Carroll from CKLB, then April Hudson from CBC, and then Kevin Dow from True North FM. So I was looking for Thomas earlier. I hadn't seen his name in the list here. So I believe I'm going to skip Thomas for now and ask Ethan Butterfield. If you have a question, Ethan, please go ahead. I believe I'm unmuting you. Ethan, are you there? Can you hear me? Okay. I'm going to pose Ethan's question for him. I don't believe he is. Ethan, can you hear me? I think you're unmuted. Okay, I will go for him. We've heard about technical problems with the vaccine passport website, including it taking up to 30 days to have the problem resolved. Can you comment on how common this problem is and what is being done to address it? I am going to say that this is perhaps a question for Dr. Kandola, but in terms of the technical details here today, I'm not. I know we don't have any technical experts in the briefing today, so I'm not sure, Dr. Kandola, if you have any more information about technical issues with vaccine passport website, but I'm going to put that to you for now.
The IT process for the proof of vaccine credentials is not under the OCFO, but perhaps Minister Green has additional details. The other thing is we're not calling it a vaccine passport, we're calling it a proof of vaccine. Just want to correct the terminology. This is an proof of vaccine that can enhance gathering limits, and it's a choice. that business and other events and organizers can use.
Thank you, Dr. Kandola. Minister Green, do you have anything to add to that at this point?
Okay. Yeah, I'm not sure if this is apropos the new system. As I mentioned in my remarks, 5,000 people have successfully downloaded their vaccine credential since the service became available on Tuesday. I have heard that people have had to try, in some cases, multiple times to fill in the form. The form is very fussy that your name is exactly as it is on the your healthcare card. So I haven't had any complaints about people absolutely not being able to access the credential. So if you have more detail about that, I can look into it. But at this point, I'm not aware of problems that are widespread or that will take months or weeks to resolve. Thank you.
Thank you, Dr. Kandola, or Minister Green, apologies. Ethan, do you have another question? I believe you should be able to, we should be able to hear you now if you go ahead. Ethan, are you there? Nothing from Ethan. Okay, I believe media, you should be able to unmute yourselves now when you have your question. So I'm going to go to Emily Blake from Cabin Radio. Emily, are you there? And do you have a question?
Yeah, can you hear me?
I can, yes, please go ahead.
Yeah, so my question is in regards to once the temporary restrictions lift and the new territory-wide gathering order is implemented, what would that mean for schools across the territory?
I think that question will go to Dr. Kandola. Dr. Kandola, go ahead.
So what the both the Behchokŭ and the Yellowknife and Ndilǫ and Dettah order are set to expire October 22nd at 5 p.m. and the new territorial gathering order is set to be in effect October 22nd, 5 p.m. So they will seamlessly flow into each other. When we are in a downward trend, which is good news, and if we continue that way, the containment order and the gathering orders for those specific communities will no longer be in effect, and schools will be ready to be opened on October 25th. We continue to monitor the situation, but the situation right now looks quite good. We have peaked and we're on a downward trajectory. This is specific for Yellowknife, Ndilŭ, Behchokŭ, and Dettah that are where schools have been closed to in-person learning. We are continuing to monitor the situation in other regions. And at this point, other than Hay River, where we, as a CPHO, have recommended that the grade 10 and 11 be assessed because of a localized outbreak, we haven't closed schools outside of Yellowknife and Ndilŭ, Dettah, and Behchokŭ.
Thank you, Dr. Kandola. Emily, do you have a follow-up question?
Yes, I know in Nunavik, an outbreak has been declared at the shelter there, and I'm wondering if there's a plan for people experiencing homelessness, like we saw in Yellowknife when there was a shelter outbreak, an additional isolation center was set up for them.
I believe we'll direct that question to Minister Green. Yes, go ahead, Minister Green.
Yeah, thank you. There is an isolation center in Inuvik now because it is a hub community and people do isolate there prior to going back to their small communities. It's the Mackenzie Hotel, and people who are recommended to isolate and who don't have a place to isolate will be accommodated at the Mackenzie Hotel. Thank you.
Thank you, Minister. All right, next I'm going to go to Luke Carroll from CTLB. Luke, are you there? Can you hear me and do you have a question?
Yes, I'm here. Can you hear me?
Yeah, please go ahead.
Okay, perfect, thank you. So I just was wondering if we could get more details on the decision to make this voluntary when other jurisdictions have made it mandatory. I'm wondering if there's any worry that this might make consumers, kind of draw a line in the sand between supporting businesses with vaccine requirements and ones that don't have it. Thank you.
Thanks, Luke. I'm going to address that question primarily to Dr. Kandola first off. Go ahead, Dr. Kandola.
Sure. So for a full year before June 2021, we were in a gathering order, which was 25 indoors and 50 outdoors. And that was for the full year. And that was a means that we used to control importation and spread risk in the N.W.T. And those were smaller gatherings. The territorial gathering order that we'll be announcing more information next week allows the flexibility. People have the choice, is you can have the smaller gatherings that we knew that had worked in the past, or with the proof of vaccination, you can actually have a higher capacity event. So it's more about public health risk. Public health risk with smaller gatherings is always a lot lower, especially when it's a mix of vaccination. But if you have the addition of requiring proof of vaccination and have primarily fully vaccinated, that also is a decreased risk. And so when I'm looking at any type of event or organization or what the business is applying, we're looking at public health risk. And we feel that we provide an option of how businesses can mitigate the risk, but in the end, they get to choose. They can choose a small gathering or a larger gathering and provide the mitigation measures. But we feel that a choice would allow better compliance and allow more freedom for people who may want to choose for smaller gatherings.
Thanks, Dr. Kandola. Luke, do you have a follow-up question?
Yeah, I'm just wondering, I know you said there would be more details coming out later, but I'm just wondering what will be the limits on businesses that aren't going to implement this requirement? If I was wondering if we could get numbers on that now.
Dr. Kandola?
So the default for everyone, just to make it simple, is we're going back to where we were in phase 2, which is the default is 25 indoors, 50 outdoors, and then everyone can apply for an exemption. So a business can apply for exemption, say, I want to go up to 100 and I will use proof of vaccination. That would, and if they are able to do that, it would be reviewed and would allow increased capacity. Another business would say, well, we can accommodate 50 and apply other public health mitigation measures. We can do physical distancing. We can continue doing the mandatory masking, which is still in order, and provide other measures where they can decrease their risk, but they'll have to accommodate less. The proof of vaccine actually just increases the number of people you can have at the event. In other scenarios, there are some high-risk activities that we still would require applications, such as funerals, indoor dancing, singing, high-risk indoor winter sports, high-intensity fitness, or contact sports. That is requiring an application regardless of the number. But if you have a proof of vaccination, you'll be able to do a lot more risky activities within that group. So it's a more optional. Do you want more people, less physical distancing? Then the proof of vaccination would be a proposal that they could use. Do you want less people but have a mixed clientele? Then you will have to have an application that takes into account other public health measures.
Thank you, Dr. Kandola. Next, I'm going to go to April Hudson from CBC. April, are you there? And do you have a question?
I am, thank you. I'm curious, I know more details are coming, but I'm wondering if you can tell me how the N.W.T plans to ensure businesses actually enforce the mandatory vaccination rule.
Thanks, April. I think we'll direct this question to Premier Cochrane.
Thanks, April. So again, it's a volunteer program, as Dr. Kandola has said. It's businesses can make the choice to stay within, not check people's credentials and allow the limits that are imposed already, or they can look to expand. The reality is we don't have enough officers to stand at every business, so that won't be an option for us. But every single complaint that is filed with 811 or protect N.W.T at gov.nt.ca is followed up. And we've given many warnings and many tickets now. So the public is using that service, and that is our best protection. So if you have any concerns, phone 811 and we'll let you know if that business is all right or not. We'll follow up. Thank you.
Thank you, Premier Cochrane. April, do you have a follow-up question?
I do, and thanks for that, Premier. I have a question, and this is going back to last week now. I wanted to ask about the case that happened at the Aurora College. They posted a notice a couple of weekends ago about a case, and we didn't see that immediately reflected in the territorial update. So I'm wondering if you can tell me what might contribute to a delay in reporting a case, and maybe if you can say something to give people confidence they're getting the most up-to-date information possible.
I missed the last part, but I think we have the gist of the question. So Dr. Kandola, I think that'll be for you first.
So every case that is identified is positive COVID is handled immediately. They're tested, told to isolate. Typically contacts are followed up, and then they do exposure history. That happens regardless. What people are confusing is case management and data surveillance. We don't provide surveillance from after our Friday update on Saturday and Sunday until Monday. So because you don't see the numbers, it doesn't mean that the case is not being managed. The cases are being managed immediately. They're being tested and isolated and followed up. Sometimes we don't release the exposure notification if there's no immediate exposure. Another organization may do an exposure notification, but if it doesn't come from the chief public health officer, it's because we have judged that exposure notification is not needed because we were able to get all the contacts. Exposure notifications don't wait till Monday. When we have an exposure, high risk exposure, we announce it. If we have an outbreak that needs to be announced, we announce that over the weekend. What we don't typically do is the whole providing the case counts and tallies. That's a cutoff at 9 a.m. on Monday to Fridays. So what the scenario happens, and it happens all the time, is at 9 a.m. we cut off, so it's standardized all the reports that come for us, and that's provided in the later on in the afternoon in the daily public health update. It doesn't mean that we are not aware of other cases that happened after 9 o'clock. So we may have 2 cases reported at 9 o'clock and 4 after 9 o'clock, but in that evening update, you will only see 2 because those 4 will be reported the next morning at the 9 a.m. cutoff. So we really need to distinguish data versus case management. Every case is being managed by public health or community health nurses right away, and the data reporting is based at a standardized 9 a.m. cutoff and reported through Monday through Friday, and not on weekends and on holidays. But it's a different tool, and it's not shouldn't reflect the case management.
Thank you, Dr. Kandola. Next, I'm going to go to Kevin Dow from True North FM. Kevin, are you there? And do you have a question? Okay, I'm not sure if Kevin is with us. Kevin, are you there? Can you hear us? If you have a question, you cannot don't have a microphone, please type your question in the chat and we'll read it out for you. In the interim, we'll skip back up and I'm going to ask one more time, is anyone from Ndilŭ here, or shall we we'll skip to the next person if not? Not hearing anyone, so I'm going to go back to, sorry, we have one person, Eric from N.W.T. Eric, are you there? Can you hear me?
Hey, can you hear me?
I can, please go ahead.
Excellent. So this is a follow-up to Emily's follow-up in regards to the outbreak at the warming and homeless shelters here in Inuvik. My understanding is that both shelters have now closed in the wake of it for presumably because of exposures. So I'm wondering in regards to isolation and such, how many people are being held up in the Mackenzie Hotel for isolation? I mean, have there been people? I'm guessing there's been a fair amount of people exposed from both shelters. Are they all being held up, and what about other people who use the shelters who may not have been exposed? Are they being accounted for in the isolation protocol at all? Because otherwise, I'm just looking out the window right now and there's about 3 inches of snow and it's going below freezing. So I'm just wondering if that's what's being done there. Thank you.
Thanks, Eric. Minister Green, would you like to address Eric's question?
Yeah, I think the Premier might have more information on this. I actually don't have information at that level. Over to you.
Apologies. Premier, please go ahead.
Thank you, Alex. Yes, the isolation center is at the Mackenzie Hotel. It is only for medically approved, recommended people, whether they're homeless or not. Any person that's medically advised that needs isolation, that can't isolate safely in their home or another residence, is put up at the isolation centers. In honesty, this is the first I'm hearing about both shelters in Nunavut being closed, so we'll have to look into that and make sure that that we have services for other people. But the isolation centers themselves are specifically for medically advised people to isolate in. Thank you.
Thank you, Premier Cochrane. Eric, do you have a follow-up question?
Yeah, this relates to it. I'm just wondering if we have the information on when the first person at the warming shelter or the homeless shelter was diagnosed with COVID-19, what specific day that was. Thanks.
I'm going to ask Dr. Kandola may or may not be able to answer that question. I'm not sure.
So we've been provided information, I believe it was yesterday, in around infections in the underhouse, and because there were multiple COVID infections, we declared an outbreak right away, instead of a public health advisory. What we really need to be careful about is that currently we have about 8 infections in Nunavut and only half are in the underhouse. And so we need to be really careful before we start labeling outbreaks in a certain direction, because in Nunavut we have a wide population and it's not always just the underhouse that will have COVID. We, at this point, we have half the cases are in the underhouse and half are not. And so we continue to work with the field, but the information around the cases were provided through the field yesterday, and enough to let us know that we were dealing with an outbreak.
Thank you, Dr. Kandola. I'm going to go back through the list again one more time. I believe we should have time for one more question from each of our media members. So I'm going to come back to Ethan Butterfield. Ethan, do you have any additional questions? I know you didn't have a second question, so you may not have any others, but I'm going to give you one more chance in the event that you do. Can you hear me? I don't hear anything from Ethan, so I'm going to go to Emily Blake from Cabin Radio. Emily, do you have another question?
Yeah, my question is with the new cases that we're seeing, are the majority of them breakthrough cases, or are the majority of cases still among unvaccinated and partially vaccinated people?
Dr. Kandola?
So at this point, we have about 14,000 people are not fully immunized. And if you look at the rates, we are seeing a higher rate of breakthrough cases in the non-fully vaccinated. One of the confusions people are looking is if you look at just the absolute numbers, it doesn't paint the whole picture. What you have to look at is the rate of COVID disease in the unvaccinated and the rate among the fully vaccinated. And right now is we're seeing a higher rate in the non-fully vaccinated or the unvaccinated at this point. And so, but on the website, we post on a regular basis, basically Monday through Friday. We always show how many cases are in the unvaccinated, partially vaccinated, fully vaccinated, those we don't know. And so roughly 30% of the cases are in the fully vaccinated, but the rate is a lot lower because there's more, twice as many fully vaccinated individuals. So best way to compare is to look at the rate. And the rate is still higher for cases in the non-fully vaccinated, and also severe outcomes is still a lot higher in the non-fully vaccinated.
Thank you, Dr. Kandola. Next, I'm going to come back to Luke Carroll from CKLB. Luke, are you there?
Yes, thank you, Allison. Um, so my question, just wondering, like, what threshold does Yellowknife, Dettah, Ndilǫ, and Behchokǫ need to hit in terms of like new active cases a day in order for restrictions to be loosened? I'm just curious what the number would be there. Thank you.
Dr. Kandola?
So we were modeling when the peak of cases would occur in specifically looked at Yellowknife and Ndilǫ and Dettah, and we've reached the peak. And so we're on a downward trajectory. And so that was helpful in making a decision that by October 22nd, if we continue this way, that we no longer need the extension. The problem is like we just reached the peak last week and we're high in the peak coming down. If we open up too quickly, we could then have an upward trajectory. So it's more this the next week or so, the next week up until October 22nd is basically having the active cases come down and going downward on the trajectory. And when we do open up for schools, we will have minimal risk for transmission. But opening up too early when you're still higher up on the peak coming down would cause increased transmission.
Thank you for that, Dr. Kandola. Next, back to April from CBC. April, are you there?
Hi, yes. I'm curious, and I know we don't have the details yet. I know it's it's going to be a voluntary program for businesses to take part of, but have there been any decisions reached yet about what's going to happen to the staff of businesses who do choose to participate? Is the GNWT going to require those staff members to be vaccinated as well?
Dr. Kandola?
So for the service industry, such as the restaurants and the bars, we are looking mainly at the clientele, and we're not doing mandatory vaccine requirements on the staff. That's an HR policy. This proof of vaccine is to allow businesses to open up more people into their establishments, but it's a different question. Proof of vaccine is around gathering limits. Mandatory vaccine as the HR policy is a different policy.
Thank you, Dr. Kandola, and thank you, April. Next, I'm going to go back to Kevin from True North FM. Kevin, another chance for you. Are you there? Nothing from Kevin. So I'm going to go back to Eric. Eric from Ndilŭ.
Hey, so yeah, this relates back to the outbreak up here. So you had mentioned, I believe Dr. Tammy Kandola had mentioned that in the events that you do contact tracing and you conclude there isn't a huge amount of an exposure risk, you don't put out an exposure notification. So I'm just wondering, since we only found out about this outbreak yesterday, how far underway is this contact tracing happening in Nunavik? And can you kind of take me through, like, if you're a person who might be exposed, but you're not going to make a big public exposure, like, what would that experience be like? Would you be phoned by public health? How would they contact you? What kind of requirements would you be under? That sort of thing. Thank you.
So
Go
this
ahead,
is
Dr. Kandola.
yeah, so this is much more an operational question, but if someone has tested positive for COVID, the most important thing is that person has to isolate so they're not passing on the infection. And then there's a detailed interview that is conducted by the nurse, typically it's a public health nurse or community health nurse, and they go back and look at where that person was during the communicable period, understanding that a person can be communicable up to 48 to 72 hours before they have symptoms. So they go back and they try to find out any exposures, any gatherings, and if that person is in a situation where they were at a gathering or a place where they can't link the contacts, where they close contacts can't be identified, then that's typically listed as an exposure notification. Public health in Nunavik are doing that right now. They're doing contact tracing on the individuals they have. So what you'll notice is exposure notifications will go out not on Nunavik of where clientele said they had attended and the time and the date. Some of these dates may seem longer than when they're being diagnosed, but unfortunately, we can only go once. The person could be diagnosed on October 14, but they could have been communicable, let's say, on October 7th. So that's sometimes when we do the history, we may get exposure notifications of days ago, but it all depends on when the individual first tested positive and when the interview can be done. So this is what we are public health in Nunavik are doing with the individuals test positive and trying to get as much of a history as possible. And sometimes and history is difficult, and we know they've been in a certain location, so we do exposure notification. We can't reliably get all the close contacts identified.
Thanks, Dr. Kandola. I know we were a little bit late starting this afternoon, and I think we only have a few media left, so I'm going to go through the list one more time. I'm going to go back quickly to Emily Blake. Emily, do you have one more question?
Yes. So I noticed that the number of cases in Fort Simpson jumped from 0 to 6. I'm wondering if what's the cause of that, and if it's a particular area of concern right now.
Dr. Kandola?
This is a well-contained exposure, and we have no concern. It's been followed well. We do not feel there'll be impact to other residents in Fort Simpson, and that's all I can say without revealing the confidentiality. But it's something that is being quickly diagnosed and contained.
Thank you, Dr. Kandola. Luke, back to you. Do you have another question?
Yeah, sure. I just wondering, like, a lot of places have like modeling for the number of cases they expect a place that, have with restrictions in place. I was wondering, does the N.W.T have any modeling for what when they think the number of active cases will completely drop off? Is there an estimate there? Thanks.
Yeah, so we have been modeling the we actually have to work with academics for this because we don't have that expertise here. The issue is as we model what was happening in N.W.T, the model consistently underestimated with their formulation how many cases we actually have, and so we have been refining the model, but the one thing that has been consistent was that the peak, specifically Yellowknife and Ndilŭ and Dettah, was expected to have occurred last week, and that did occur. We also are modeling hospitalizations, and there is a lag period between when we have the peak of number of cases and the peak of hospitalizations, because people typically it's a 2-week lag, and so we're seeing that a peak potentially in hospitalizations in November. The only concern is this is based on our current activity and we're trending downward, but if there's an uptick in activity, we would have to reconfigure the modeling estimates. But the one model we were using was the consistently underestimating a number of cases.
Thank you, Dr. Kandola. Next for you, April from CBC. Last question, April.
Hi, thank you. I think this question is probably to the health minister. One thing that we're looking into here, the FDA has recommended a booster of Moderna for 65 plus and young adults who are higher risk. Considering that the N.W.T has said that we're seeing some waning immunity here, is there a plan to expand third doses? And who would make that call? Is it the feds or is it the N.W.T?
I know your question was for Mr. Green, and Mr. Green, if you'd like to address it, please feel free, but I know that Dr. Kandola may have some remarks on that as well.
Yeah, I suggest Dr. Kandola answer this question.
Thank you. I think that was a great decision that occurred just literally an hour before we had this media conference, where the US FDA have approved that half dose Moderna booster, 15 micrograms for 65 and older, and again for those 18 to 64 at high risk, and also 18 to 64 high risk from a profession point of view. That's a US decision. And in Canada, we follow the National Advisory Committee on Immunization. We, in N.W.T, we have made a recommendation of third dose for the immunocompromised and a boosted dose for long-term care congregate facilities, as well as a boosted dose for 75 plus and older, and a boosted dose for frontline workers. So we do know, we do have information around waning immunity, particularly in our seniors. And so we're going to look at the findings or the recommendation of the US and look at our own population. The call would be CPHO directed in a scenario such as this, where we are seeing just an increase in COVID activity and some waning, especially resulting in some severe outcomes in older population. So those are decisions that I typically now have to make. However, typically a National Advisory Committee Immunization makes recommendations on who's eligible, who's not, around booster doses, and they're looking into that as we speak, but they'll making recommendations later on, so their results might not be available till the end of October. In the interim, we, as a self in N.W.T, I will be looking at that US FDA decision and looking at our own population.
Thank you for that, Dr. Kandola. And one last person on our list, Eric. Are you there still, Eric? Do you have one more question?
I am. I just need to make a call out for my colleague, Ethan. I see he has typed out that he also has another question. But anyway, that aside, this last question, I guess, is a follow-up on my previous one in regards to contact tracing. I'm just, I understand it's still underway right now, but is there any sort of a timeline we can expect to, if there is any exposure notifications, such as at the grocery store or corner store or any of the other places that homeless people tend to hang out at because they need something to do? How soon can we expect that, I guess? Thank you.
So one of the, just the different roles, so the office as Chief Public Health Officer, we play a regulatory role, we're territorial, and we rely heavily on operational response. regional health authorities, and they are working actively to do the contact tracing, provide the exposure notifications, and we will be posting the exposure notifications pretty much today, as soon as we can. This is an ongoing process because ongoing interviewing is occurring as we speak. And if there's more cases, there's more contact tracing, more interviewing around exposure notifications. But when we do get an exposure notification, we will post that. But what I can say for people in Nunavut is there are rules that we can live by and we have control over. So there's a mandatory masking order for indoor public use. There's recommendation on physical distancing. Stay home if you're sick and you arrange for testing. Wash your hands frequently. Keep your gatherings small. These are things you can do right now to control your risk of transmission, control the risk of acquiring COVID. And the most important intervention you can do if you're eligible is to get vaccinated.
Thank you, Dr. Kandola. And I do have one more question from Ethan, and that is, he's asking about an update on when schools will be reopening. So I believe that will be for you, Dr. Kandola.
So it's been tough because I myself have a son who's been out of school as well. The situation in Yellowknife and Ndilǫ and Dettah, Behchokǫ was last week. It was quite tense because we still hadn't peaked. We still having active cases. We were still having workplace transmission, institutional outbreaks. But has we had that containment order in terms of containment around household containment and gathering limits, and as people stuck it through and were compliant to the order, I can honestly say we have peaked in terms of our active cases. We're on the downward trajectory, and following where the downward trajectory is going, and barring no unanticipated large-scale outbreaks, we are expecting that the gathering order for Yellowknife and Ndilǫ and Dettah and the containment order will be completed on October 22nd at 5 p.m., which will be replaced by a territorial gathering order, but schools should be open for Monday, October 25th. And I just do want to do a shout out for everyone who's worked hard and spent countless of hours doing the contact tracing, enforcing the checkpoint at Behchokǫ, working at the shelters, working at the isolation hotel. Like, the fact that we peaked on the downward trajectory is reflective of how residents comply with the order, but also the frontline workers and everyone behind the scenes to make sure people are tested and traced as quickly as possible and not isolating. And this is why we're seeing less and less active cases each day. So thank you, everyone in Yellowknife and Ndilǫ, Dettah, and Behchokǫ.
Thank you for that, Dr. Kandola. And I would like to now take the time to thank all of our speakers here today, Premier Cochrane, Minister Green, Dr. Kandola, thank you for your comments. Thank you to everyone in attendance for your patience as we got started a little bit late and for sticking with us through this. I want to mention, if you do have follow-up questions, please address them through the Press Secretary's office, and we'll do our best to get you the answers to those questions in a timely fashion. With that, I wish you all a good afternoon, and thank you very much.